We're going to talk about the Phoenix Children's Heart Center, kind of about around Heart Month, but also all the expertise and kind of what's happening in the future here. And to do that with me today is the Division Chief of Cardiology, Dr. Joe Graziano. How are you?
Good. Thanks,
Good.
Peter.
Yeah. So before we start today, as I always say, let us know you're out there. Give us a like, give us a love. You can ask questions, and we do love questions. So if you put a question in the comments down below, my capable colleague Jeremy will let us know the questions, and we'll get answer those as soon as we can. Otherwise, we will answer them after the broadcast. So definitely give us those questions. So with that, I think, like I always do with doctors, that this is your first time doing a Facebook Live, isn't it?
That's correct.
All right,
yeah.
so here we go. new meat for us, though. So tell us a little bit about yourself, just to start us off a little bit, so people have a background on who you are and what you do here at Phoenix Children's.
Yeah, so I'm one of the pediatric cardiologists here at Phoenix Children's Hospital. I am my niche or field is interventional cardiology, and which I'll talk a little bit more about. And I'm currently the division chief of the division of cardiology. So my background is my education was at University of Michigan for college. I went to medical school in New York at Columbia University, and then did most of my medical training in Michigan. Yeah. I did my pediatrics training there. To become a pediatric cardiologist, you train in pediatrics, and then you can specialize after in cardiology and what's called a fellowship. So I did my fellowship in Michigan, and I stayed there for several years, and I moved here in 2005. So I've been here in Phoenix for almost 13 years now.
Yeah, so you don't want to be back there now because they're getting a ton of snow.
No, that was partly why I moved here. So I don't miss the snow.
Right, right. Well, we'll go forward here. So as I mentioned, it's American Heart Month, and so according to the American Heart Association, so they say an estimated 40,000 babies are born every year with congenital heart defects, and so 1 in 4 has a critical congenital heart defect that requires surgery. So, and they say that a lot of babies leave their birth hospitals with that heart defect undiagnosed, and then can miss the window for surgery. That's big news, and we need to get that out there more. But we, in addition to that, we want to let people know that we can deal with those kinds of things here at the Phoenix Children's Hospital at the Heart Center here. Yeah. And I think to put that into context, I want to just kind of talk to you about what maybe a patient's possible journey might be when they come visit us, possibly with a heart defect. And kind of that journey is, kind of this proactive approach where we might find it in the cardiology stage, mm-hmm. and then if it's progressive and it goes forward, then it might be in the surgery kind of stage, right? Yep. And then in the final one, if it's bad enough or severe enough, then it might be a transplant at that point, right? Is that kind of what a family might understand as their journey, if so to speak?
Yeah, and your statistics are correct. About 1 in 100 babies born across all races and economic classes are born with a heart defect. Which amounts to about 40,000 babies a year. So it ends up actually being the most common birth defect in children. So it's actually not an uncommon thing for a baby to have a heart defect. Now, a large majority of those are actually relatively simple things. Not all of those require surgery. I think you even said about 1 in 4 end up needing surgery or some sort of intervention, and that's probably true. And there's a whole spectrum along which some of those defects can be diagnosed. You alluded to the fact that some babies go home and the families don't know. And in part that can be because some of them don't cause problems or symptoms until much later in life. Mm-hmm. But we can step back and look at from the very beginning. A baby is born and let's just say we know they have a heart defect. What are the stages from there? Mm-hmm. So defects often can be diagnosed even in utero now, and we'll talk a little bit about the concept of fetal cardiology, but as part of a screening ultrasound, all pregnant moms get an ultrasound, and if a cardiac issue is picked up, they'll often see one of our fetal cardiologists. So for many defects now, actually those can be diagnosed even before babies are born, which is nice because it obviously allows families to plan and educate themselves and so forth. But even if they're not diagnosed right at birth, there are often some physical signs or symptoms that a pediatrician might pick up that would lead a baby to be referred to us. So as you said, the Heart Center has many components, but the first step would be for a baby with a heart defect to see a cardiologist. Mm-hmm. Sometimes that can be while they're in the hospital. Sometimes it can be they see their pediatrician who notices something and they come to our clinic.
Depending on the severity of it, maybe.
Exactly, yeah.
Mm-hmm.
If they're very severe, obviously the baby might be in the hospital, but if the baby's doing well, but it's a murmur on an exam, for example, or some other unusual sign that they're worried about, they'll come see us in our clinic.
Labored breathing or something like that, maybe.
Difficulty feeding,
Yeah.
labored breathing,
Mhm.
discoloration, or things like that, that somebody might be worried about a defect. So usually we are the kind of entry level, so to speak, into the heart center, the cardiologist. So as a cardiologist, our job is to diagnose the heart defect and manage the heart defect as best we can with either medicines, procedures such as interventions, we'll talk about some of those, or it would be our job to then refer patients for things like surgery, more corrective type options.
Farther down that journey, as we were saying. Right?
Hopefully, yeah.
Yeah.
Hopefully not at all, but yeah,
Right,
hopefully
right.
farther down that journey. So the heart center here at Phoenix Children's Hospital really we think of it as having 4 components. So cardiology is probably the biggest and I think most important, but not to
What does
belittle
it say,
the
cardiology on there?
There is also cardiac surgery, which we'll talk a little bit about, and we also consider the cardiac ICU as well as our anesthesia team. The 4 kind of pillars are important parts of our heart center. So a patient who comes in as part of the heart center is introduced through the cardiologists. So I mentioned that 1 in 100 number. Most of those babies will have issues that probably don't even need the other 3 specialties.
Okay, that's
They're
good.
usually things maybe that can be managed with medicines. They might be minor things that just don't even require any intervention, just monitoring through our visits and so forth. Some of them, like little small holes and things, close up and go away, and then we discharge them from
I think a quick thing on that too, not in the notes, so don't worry, I'm not going to throw you too much of a hardball here, but you know, I think as parents that may have a baby that might have the murmur or something slight in your terms,
Yep.
I think it's important for parents to not feel like it's a burden for them for you guys to check those things out. So even if they're, you know, just got a bad feeling about something, or their pediatrician might say, oh, I don't know, it's just a tiny little thing, but it's probably nothing. If they want to get it checked out, I mean, that's exactly why you guys are here, right?
Absolutely. I mean, that's why we're here. And in fact, the majority of patients that have murmurs and simple things like maybe labored breathing or things we touched on, most children with those things don't have major heart problems, actually. So it's not uncommon that we see children for murmurs or things like chest pain that people are worried about. And in fact, they're completely normal. And that's, as you said, that's why we're here, is to try to filter those out. And no one should feel bad, either the pediatrician or the family should feel bad about that. So we love giving good news. I love it when I see patients with murmurs and it's nothing.
Yeah,
So
yeah, that's exactly.
no one should, feel bad about that. And like I said, that's actually fortunately the majority of the things that we see.
Yeah, yeah. So with cardiology, as I was looking through the website, there's a lot of programs under cardiology, and I
Yes.
wanted to just touch a little briefly on each one of those and kind of talk about what we have and maybe what's coming up in the future for
Sure.
this year in 2018, which I can't believe it's 2018 already,
Yeah.
and then maybe into the next by 2020. So we talked about the different programs. So let's just kind of go down the list real quick. So the fetal cardiology program, and here's your chance to talk about that in utero kind of surveillance, if you will.
Yeah, I mentioned the concept of fetal cardiology. So Dr. Chris Lindblade is the director of our fetal cardiology program here, and we have several fetal cardiologists. And the role of a fetal cardiologist is to essentially do an ultrasound on the pregnant mom to look at the baby's heart. I'm always amazed at the things they can diagnose, the complexity of heart defects that they get right on a heart that is, just tiny in size. So what that allows us to do, as I alluded to earlier, is number one, be prepared, so that if it's a baby with a very severe heart defect, we know about that ahead of time. Every once in a while, there are babies with heart defects that we can anticipate from the time they come out are going to be very sick from minute one, and so that allows us to be prepared. Sometimes that means having a whole team available when the baby is born in the cath lab or in the OR, whatever that might be. So it allows us to be prepared. It allows the families to be prepared. They're able to educate themselves as to what's going to be involved, whether it's surgery or other procedures. And even if they're simple defects, it's nice to know ahead of time, so even if they're not going to require surgery right away, the family has a little bit of time to, you know, to understand what's going to be involved, and the timing of that. So.
That's big too. I mean, just to be even emotionally prepared too for something like that, right?
Exactly. Yeah. Some of the defects, there's a whole group of defects where your heart has one pumping chamber rather than two, and that actually requires a series of surgeries, and that requires, after surgery, a pretty intensive follow-up program, which we'll talk about in a second. But you're right, it's a pretty big stressor for families who have jobs and
a newborn.
kids and a newborn, and they need to make arrangements with maybe family members, or so there are some families who live far away and need to stay close by. So you're right, in that sense too, it allows families to kind of be prepared.
Yeah.
So.
Well, let's segue over to the next one. So the pediatric arrhythmia program. So that's kind of another one of these great programs under cardiology. Talk a little bit about that as well.
Yeah. So an arrhythmia is an abnormal heart rhythm, and you can have fast rhythms, you can have slow rhythms, but it's basically a problem with the electrical system of the heart. And so we have two electrophysiologists here, Dr. Ree and Dr. Pepez, and they focus really primarily exactly on that, on the treatment of heart rhythm problems. This is also a field over time that gets more and more sophisticated with equipment that allows them to actually map out the electrical activity of the heart. So it involves a procedure where you can put a catheter in through the leg. It's usually a procedure where the children are asleep, but you can put a catheter in through the leg and map out in 3 dimensions the electrical activity of the heart, figure out where those abnormal rhythms are coming from. And then there are ways with catheters that get either really, really hot to burn an area or really, really cold to freeze an area, but a very, very localized area with a catheter that fixes the arrhythmia.
And the key for that for parents is the minimal invasiveness of it, right?
Exactly.
So it's not full open heart surgery for an infant at that point. It's literally going in through the leg, like you said, and doing it that way rather than full open heart surgery, which is amazing.
Yeah, and in fact, many of these things, because they require a mapping of the electrical activity, which is obviously not visible, they can't even be done, or they're very, very difficult to do with surgeries. But yes, they are minimally invasive with catheters that go in through the leg, and you stay overnight and go home the next day.
That's amazing. And
oftentimes they're curative, so it's a nice option that avoids the need for medicines and fixes the heart rhythm problems.
So what would be interventional cardiology then? How's that a little different then?
Yeah, so the way we like to explain it, I'm one of the interventional cardiologists, and Dr. Ree and I always have a joke. Occasionally we do some procedures together, but when we're in there talking to families, Dr. Ree likes to explain, he says, I'm the electrician, he's the plumber. So we deal with the kind of plumbing aspects of the heart. The vessels, valve problems, holes in the heart, how blood flows through the heart. So the job of the heart obviously is to squeeze and pump blood. So the electrical activity stimulates the squeezing of the chambers, but you still have blood vessels and blood flowing through the heart. So as an interventional cardiologist, what we focus on is the diagnosis and treatment of heart defects with catheters that go in through your leg, just like the electrical doctors do. But we focus more on some of the plumbing issues. So if you have a hole in the heart that needs to be closed, if you have a valve that doesn't open correctly, those are things now that we can often treat with catheters that in the old days, and by old days I mean, for some of these conditions, it's 10 or 15 years ago, required surgery. And now these are things we can fix with catheters that, like you said, there's no scar on your chest, it's a catheter in your leg, you go home the next day. One of the most exciting areas for us now is the concept of actually implanting new valves in the heart. So traditionally, up until a couple of years ago, the standard treatment for that was to, surgery. And now, through new technology and development of new devices and things, there are devices we can have that we can put in through a catheter, implant in the heart, and prevents children from needing multiple surgeries. So.
And we'll talk a little bit about this too, because we're going to have a story coming out this month, Jackson, and that is the Melody valve. And that the coolest thing about that is that how you explained it. And you guys will see this video as it's getting ready to come out. That these things are customizable. So as the child grows, it kind of grows with them, and you don't have to go in and do major surgery to keep changing things out. It can go in through the catheter and kind of open it up as the child grows, and those kind of the plumbing needs to get bigger.
Yeah, exactly. So the concept that you mentioned, the Meli valve is a valve that kind of sits in a stent. So a stent is a metal tube, and we use stents for a variety of things too, to open up vessels that are small. So, and many of those, like you said, the problem with putting those in young children, or putting any devices or things in young children, is they are going to grow quite a bit.
Yeah.
You think of the size of a baby versus you or I. Those vessels inside the heart grow as well, and so we are able to, with the stents and some of those valves, like you mentioned, are able to kind of make those bigger over time, and it's usually a straightforward procedure, again, with a catheter that goes in that can adjust those. So
that's amazing.
Yeah.
Let's talk about the interstage. You were kind of mentioning that before we got on here a little bit. What is that?
So the interstage program is an important program in our heart center, and is basically a way for us to follow children with very critical heart defects, usually the single ventricle type defects, in a very close manner. So we know from previous experience that patients with single ventricle defects require several surgeries, and we know that there's a time of what we consider the high risk period between the first and second surgery.
Yeah.
So even 10 years ago, the concept was that you would send patients home and see them frequently in clinic, and you hope they would do okay.
Right.
And the truth is, there are some patients that would run into problems, and there was a concept that began about 10 years ago from a couple of centers around the country to be able to try to follow babies a little bit more closely with daily contact with the family by texting, or sometimes more sophisticated means with iPads and things of that sort.
Mm-hmm.
And we empower the families and give them a little bit of equipment that they take home to be able to measure the baby's oxygen saturations and their weights and things like that, to be sure that they're gaining weight. All of which has been shown to be predictive of outcome. If babies have saturations that are good and they're gaining weight, it's a sign of good health. And so the interstage program, in fact, we were one of the first in the country to adopt a formal interstage program, which is now kind of standard at almost every center, but involves basically, it's almost like a home monitoring program where we give parents that equipment, like I mentioned. They are in essentially daily contact with us. They have a hotline number that they get one of the docs or nurse practitioners devoted to this program. So if there are any questions or concerns at all, we pick up on those very, very quickly.
Yeah.
And nationwide, and including our program as well, we've been able to show that very, very close monitoring has improved outcome.
Yeah.
Our interstage program, fortunately, in the last 2 years.
He's knocking on wood.
Yes, it's wood here. The last 2 years, we've had no serious adverse events or deaths for patients that are at home for defects that traditionally have had sometimes even up as 10%.
Pretty tenuous stuff.
Yeah,
Yeah.
very tenuous stuff.
So I think a lot of people would be surprised to say for the next one we have an adult congenital heart disease program, and I know I did air quotes, but it is truly an adult congenital heart disease program.
Yeah. So we, families sometimes ask too. And I had a family last week, their child is 19, or he's not a child, he's an adult. And so they said, well, he's an adult now, like, does he need to find an adult cardiologist? And the answer is that for many defects, certainly complex defects, the surgeries for some of these defects are relatively new, such that most adult cardiologists don't have a lot of experience. There aren't a lot of 40, 50, 60-year-old patients with certain types of defects. And so the most experienced people at taking care of patients with these defects and these surgeries are actually us, because we've been dealing with this for a long time. So based on the type of defect, what we tell patients is that we almost never kick you out of our clinic, and that we continue to follow you because we have the best knowledge of the congenital problems and the congenital issues with their heart. And so it's evolved into actually a whole field now of adult congenital heart disease, which has been a growing field. And yes, we've had a program here for several years. Dr. Craig Cohen is one of our cardiologists that has devoted really the last 10 years of his career in taking care of adults with congenital heart disease, and it's a program that we need more help with, and we're actually recruiting for several components of that program, but
Excellent.
will continue to grow.
Good program. If you've seen this as an adult congenital heart person, come on in. We'll take a look. So the last area that I wanted to touch on was the pediatric heart failure program, which is kind of in the transplant area, basically. So talk a little bit about that.
Yeah, so for patients in whom their heart has failed or they've had other issues that make additional surgery on their heart not feasible, there are some patients who eventually need a new heart as the final treatment for their heart defect, which is a whole separate field in and of itself in transplant medicine, basically. And so we've had a very active transplant program, and I'm trying to remember exactly when. It was about 2011 was our pediatric heart transplant program that Phoenix Children's here started. Prior to that, actually there were patients that had to go elsewhere if they needed heart transplants, either down in Tucson. There was a program at St. Joseph's Hospital when we merged, and we've had a heart transplant program here since about 2011. And we've recruited several physicians. Dr. Steve Zangel is the director of our heart transplant program, and more recently we have been able to recruit Dr. Michelle Plounce, who is another transplant physician as well, who has an interest in some ventricular assist devices and other forms of mechanical support, which are ways to basically support a heart that's not doing well until you can get a new heart. So for us, it's been a field or an area that's grown tremendously, and in fact, in 2016, so 2 years ago, we were actually the second busiest program in the country. 2017, I think we were number 7, number 6 or number 7, but over the last
still
2 years,
10.
It was still in the top 10, and over the past 2 years, we've told, I think it's 41 heart transplants in children for pediatric heart transplants, which places us as one of the the biggest and most successful heart transplant programs in the country. Yeah,
that's excellent. All right, so back to that journey as we were talking about before. So the next that next part of the journey, or next part of the area that we are experts in here at the Heart Center, is heart surgery.
Yep.
Cardiothoracic surgery.
Yep.
So you work with your colleague and co-chief, Dr. Daniel Velez.
Yeah.
And he's how's it working with Dr. Velez? He's
great. Anybody that has met Dr. Velez knows he's a very easygoing, very easy to talk to, a good guy. In the field of, and I can say this, in the field of cardiac surgery, those guys sometimes have relatively large egos, and they're sometimes a little bit difficult to work with. And we've been very fortunate here at Phoenix Children in general, actually, that our surgeon, and certainly Dr. Velez, is very collaborative, very easy to work with.
Yeah. And that's important to have that team concept.
Completely. And in fact, just to establish a good working relationship is important, but for the patients as well. And so I think we'll get to an example, but we need to work collaboratively in some of the things that we do. I always joke with the patients, and I joke with the surgeons, that as an interventional cardiologist, I always like to think that I can save the patients from needing the surgeon. We can do procedures that they don't need surgery. But the truth is, there are patients that still need surgery, and the truth is, it's not an ego thing. We're trying to do what's best for the patient, and there are some times where maybe skills that I have and skills that he have can be put together to do things in a collaborative way, and you have to have buy-in on both sides for people who are willing to think outside the box, or if I go into his operating room or he comes into our cath lab, that it's a very collegial relationship where we know we can sort of think and talk together about what's best for the patient.
Well, I'll go over to it, because as I mentioned, we're gonna have a great patient story video to put out in this Heart Month, and that's exactly what happened with Jackson and with his parents. And as I said, we're gonna have a video on that, so stay tuned for that. But and Dr. Velez said it. He actually came in this office. This is your office that we're recording from today. But and talked about this, and this was the Melody valve that you guys implanted into little Jackson. He was 7 months old, I believe. So I think the cool thing about this one was, and I'll let you tell it, but this was kind of a first for Arizona. So we put it in a different position. Give it a little background.
Yeah, so the Melody valve is a valve, I touched on it a little bit earlier. It's a valve that is intended to be put in with a catheter into a patient's pulmonary valve, which is a valve that allows the blood to go from the right side of the heart to the lungs. It's an available valve that we can use in patients that we think is appropriate, and for some patients, actually, it's the concept that perhaps we can use this valve in other positions as well. It wasn't really intended for that, but it does work in other positions in the heart. And in particular, Jackson, as you mentioned, was a baby who had a problem with the mitral valve, which is a valve inside the heart that allows the blood to go from the left atrium into the left ventricle. And he had had surgery on that valve and had an abnormal valve that was difficult to fix. And so we're not the ones to invent this idea. There have been several centers around the country who have said, hey, maybe we can take this Melody valve that we know we can put in with the ability to make it bigger, and they don't need blood thinner medicines and so forth, but maybe we can put it in the mitral valve as an alternative that will allow him to grow and get bigger, and we can actually make this valve bigger over time. And so for Jackson, he had a problem with his valve that was really difficult to deal with, either by fixing the valve or by putting a new valve in there. And so at one of our conferences, we all were discussing ideas, and I think it was Dr. Velez who even proposed the idea of using this valve in the mitral position. And so we decided and elected to do that. And so we, as the interventional cardiologists, have a lot of experience with the valve and how it works and how we put it in. And so this was a procedure that we did together where Dr. Velez sewed the valve in, and then we could make the valve a little bit bigger in the operating room with the balloon, the way we always do.
Yeah.
And it really worked nicely. And he's home and he's doing well.
Yeah,
and we will probably need to go back in the future and make that valve a little bit bigger. But it was an example of how kind of thinking outside the box in a team approach. It wasn't about Dr. Velez or our cath lab or anything like that. It was about taking a technique that we thought would work and working as a team to make it, do something new and innovative for him.
So I think the outcome of that is sometimes you see the outcomes of those types of things happen in accolades and recognition, and that's kind of the next segue is that we have again received the 3-star rating from the STS, which is the Society for Thoracic Surgeons.
Yep.
So I think the more that we do these kinds of collaborations and this teamwork approach, and the benefactors would be the parents out there with the kids, these are the kind of things that kind of I guess they kind of solidify our standing here, and we keep getting better. I don't know, is there anything you want to kind of add about the 3-star rating?
Yeah, well, that's a huge deal for us, and we're really very proud of it.
4 years in a row now, too, right?
4 years in a row, yeah. So the STS is the Society of Thoracic Surgeons, and they have a way to assess the congenital heart programs in the country based on complexity of surgeries and outcomes and things of that sort. And they rank them on a scale of 1 to 3 stars. 3 being the highest, and of the I think it's 115 centers around the country or so, we have had a 3-star, so we've had the highest rating for 4 years, as you mentioned, which and actually there have been only about 12 or 13 centers in the country who have had 3 stars. So it really puts us in the top tier of programs from around the country, as one of the best.
That's excellent.
So it's and I should add that it is a really kind of, I mentioned the components of the heart center, and I know Dr. Velez would say this as well. It's not a reflection on one person per se, although he does the lion's share of the surgery, which is, we'd all say, is probably the most difficult part. But these are very complex patients, oftentimes, that require sophisticated preoperative care by our cardiac ICU, in the OR by our experienced anesthesiologists. After surgery, they are often in the cardiac ICU, and us as cardiologists are very involved in their care. And I would say, without any of those components, and I know Dr. Velez would agree that, the outcomes wouldn't be what they were, and our program wouldn't be a 3-star rating. So I want to commend all the components of the Heart Center, who all should be proud for that 3-star rating. So,
yeah, even Jackson's family, when we were filming the video, they had nothing but great things to say about the CVICU.
Yeah.
Did a great job up there. So So I think the last area that I wanted to quickly talk about was transplant. Not to give it a last but certainly in that least approach. But Dr. Velez, Dr. Zangwill, Dr. Plautz, as you mentioned, Cass, Smith Fields, April Cologne, and Stacy Grohall all do a great job, and have really contributed to all those numbers that you said earlier about how we have just taken that program and really kind of went forward with it.
Yeah.
And I love this program. We fly a flag when we do the successful transplants, and you know, you had talked about how amazing this is. Is anything else that you wanted to add there? I mean, I think it's pretty amazing.
Yeah, it is, especially when you can think of how complex these patients are before getting new hearts and how complex they are after. So these are patients that are seen very, very frequently. As part of their assessment, we do, so I end up seeing them frequently as well. They get heart catheterizations, and we need to do heart biopsies to check for rejection and so forth. They're on a whole list of complex medications that require adjustments and so forth. And so all the members of the team that you mentioned there should be commended, you know, because these are patients that are require very sophisticated ongoing care very closely. And again, our good results are due to the, you know, diligent work of all those people. So.
Yeah. Well, couple last things, and then we'll be done with our session today. But I wanted to quickly talk about how you guys work with other areas on the campus. The NICU is probably a really good one. You probably work pretty closely with them. Yeah. What's that relationship like?
Yeah. So I mentioned the CVICU a little bit. The NICU is the neonatal intensive care unit, which also should be given a lot of credit for the care of our complex babies. So. Babies that are born with heart defects are often taken care of in the neonatal ICU up until the time they have surgery. Yeah. Here at Phoenix Children's Hospital, it's actually a little bit further away from our cardiac unit, but we maintain a strong presence there and involved on rounds and have a very good relationship with the neonatologists as well.
Yeah, it's good. It's all on one campus, which is another great thing for parents too.
Yep.
Last but not least, certainly we have a very active Heart Center Family Advisory Council, and I wanted you to give them a little shout out too, because they're very integrated into kind of this, and that's interesting. I think a lot of people don't know how a kind of an outside group, so to speak, if you will, but a Family Advisory Council, how do they work with the Heart Center here? And it's a very vocal group, and I think they have great insight. But how does that help you guys?
Yeah, they do. I mean, they provide insight that we as physicians don't always have. So the Family Advisory Council meets, I think it's monthly, and they just started their term this year, so it's February now. In fact, they just met last week. And they come up with an agenda of topics and things that they'd like to accomplish for the year, and they're very different in scope than what we do. And so as physicians, we try to attend Dr. Velez and myself and some of the other cardiologists, and we are there as kind of observers. We don't run the meeting, it's run by them, and gives us a chance to understand the issues unique to families that we might not have considered. Sometimes simple things on how we do rounds and how families are involved in rounds. It's actually a thing we try to do now. We call it family-centered rounds, is that when we round as a medical team up there, we like the families involved as well, so that they understand the discussion. They're there to, you know, ask us questions, and so we have their input as well. And that began, you know, as a concept by Family Advisory Council members who, you know, thought this was really very helpful. So, for families, this is a way to really get involved in other things that go on within the Heart Center.
And just so you know, we just restarted up the Heart Center, the Family Advisory Council newsletter. We're actually combining it with the official newsletter from the hospital or from the Heart Center. It's called Heart to Heart, and we did a Facebook post not too long ago. You can sign up and get on the email so that you get it. It's going to be quarterly, and as I said, it's a mixture of what the Family Advisory Council from the Heart Center has in terms of their news and our news, and I think it's a great partnership. And I will say that once we put that out there, I'll shout outs to the Heart Center Family Advisory Council. They've been around for a while, because I saw they were talking about back on 9/11, you know, when people were here and they had families, and they were talking about you know, what a great experience they had, and it just was, so you see the history. I was actually reading the history, so it was great to read all your comments on the Facebook page. But we'll put the link to get on there on this particular link or this post for the Facebook Live, so you can, if you missed it the first time. But do want you to get on there and join up and hear about what's going on a quarterly basis for the Heart Center. So we went a little bit over, but that's okay. All good stuff. And thank you so much for joining today. I really appreciate that.
No, thanks for coming. You're welcome back anytime. This is fun.
I appreciate it. And you know, keep an eye out for Jackson. I know that'll be great. And happy Heart Month. And again, send us any questions and we'll get back to you as soon as we can. Again, Peter Balistrieri, Dr. Joe Graziano, thanks again for joining us. We'll see you.
Bye-bye.